So welcome to the shoulder, knee and foot biomechanics page. So here I'm going to explain to you through this short video what exactly you're going to get on these 3 days. So we're going to start with the shoulder biomechanics section, and in this section we're going to fully assess the shoulder. You have 3 nerve screens in the arm, or nerves tests, and then we have 4 shoulder screens, understanding muscle spasm around the shoulders. That's subclinical muscle spasm, which we'll explain on the day. Relevant to the tests, each test we have again a series of muscle energy techniques, nerve mobilizations, and then antagonist strength training to improve the strength ratios around the shoulder joint. Following the shoulder biomechanics section, we're going to take you into the knee biomechanics. There are 3 tests for knee stability. Understanding when your clients are running, jumping, moving around in their sport, whether they're at risk, how to assess the knee, and then to understand strength training to improve the function and stability around the knee. Finally, within this module, you have the foot biomechanics section, and there are 6 tests within this section to help you understand your client's foot function. Clearly, we're not turning you into podiatrists, but we do give you the ability to communicate with a foot specialist using the right language and understanding both pronation, supination, what they mean to your client, and their movement capacity. Again, these come with an exercise intervention. We call it POCing, which is pre-orthotic conditioning. That's going to bring you a little bit closer to the foot specialists and allow us to create fantastic referral systems.